Hello, everyone. My name is Luís Filipe. I'm a lecturer in health economics at Lancaster. And today I'm substituting Valerio, who cannot be here in this session, in this presentation session about selecting an economic evaluation. I have with me Cath Harris from the MIDAS team and the University of Central Lancashire. So, Cath, if you want to present yourself.
Hi, I'm Cath Harris. I work at the University of Central Lancashire and I'm an information specialist, so I'll be helping to deliver this session.
Thank you. So today it's going to be about how to select an economic evaluation. It's also going to be about a little bit of housekeeping and explaining how this this course is going to work. Just to let you know, the session is being recorded. All the sessions will be, after it ends, eventually be put on YouTube, so you can always go back and check them. If you have any problem about it being recorded, please just tell us, because otherwise we are just going to put it in there. Okay, so no issues. Can we start? Okay, so let's talk about the RaCEEs. What are the aims of the RaCEEs? So the aims, you are here, so you probably already know more or less what the aims are, since you chose to be here. But the aims are to basically to grow the skills in health economics, and in particular in health economic evaluations across the ARC Northwest Coast. For that, in this course particularly, we want you to learn how to critically appraise an economic evaluation that then potentially can be worth to inform policy change and practice, depending on where you work. And in fact, since this is the objective, what we aim for is at the end of this workshop to be able to produce a commentary that we want to disseminate as by publishing it in a journal. So that has been how we have doing it. We design all these workshops so that at the end we can have this deliverable, this commentary, and also as a prize to ourselves, try to have it published, to be there for consultation of everyone. Now, how is this RaCEEs workshop going to work in terms of the sessions and the timelines? So first session, today's session, is about choosing a research question to select an economic evaluation, which hopefully is the one that we are going to use throughout the rest of the course, and at the end make a commentary about it. Then the second session is going to be around the methods of an economic evaluation, particularly the key attributes of an economic evaluation. Then the third is still going to be about the methods, but this time it will be about the costs. Then the fourth, still on the methods, because it's tricky. There's a lot of methodology around economic evaluations. This one is going to be about the outcomes. Then the fifth, it's going to be about the results, how to interpret the results, understanding all the tables and the graphs that are usually used. So we look at the base case and then also at the sensitivity analysis or subgroup analysis. And finally, the sixth is going to be about how to motivate our commentary. It's going already to be kind of start writing in a way. We will not write on the day, but it's about writing the commentary, talking about how to make the introduction, how to motivate our commentary, also to provide a little bit more of information about the workshop, which is going to be our last real session, let's say, and a little bit of Q&A. Then finally, the workshop. So in fact, it's a 7-session course, let's say, and the workshop is an entire day that will happen in Preston, in UCLan, in the University of Central Lancashire. Is it still, Cath? And then, or did it already change the name? Is it the University of Lancashire?
Still the same, University of Central Lancashire until that's
okay. And it's a very nice day where we come together and we basically critically appraise the economic evaluation that each group has. It's my opinion, I really enjoyed that day, so I hope you enjoy it as well. And we really want you to be there while the sessions, all the other sessions, if you cannot be here, it's not a big problem because you can watch them online on YouTube. We always put the sessions there. The workshop, it is face-to-face, and it is a really good event where you really should be there because it's a fun event, it's a productive event, and you are very much needed in order to be able to write the commentary. So, but today's session 1. Let's just first look at the key dates. So again, you saw 6 online sessions, right? And 1 face-to-face session at the workshop. And here you have the dates already. Session 1 today, then the next on Monday the 2nd, then the other Monday the 16th, Monday 13 for the 4th, Monday 14 for the 5th, Monday 28th for the 6th, and most important of all, I was saying that the numbers, I forgot the months, but you can see it's going from now May until July. And then this one is the one that you need to have into account. It's the Tuesday, 2nd of September. So really try to clean your schedule for that day. Really try to make it because it is, like I said, it's a fun event. It's very productive, and we really need you in order to be able to write the commentary. Now, we are going to implement something new that we haven't done in the previous one based on feedback, which is just, we are going to start these sessions. Instead of starting at 10, we are going to start at 10:50. So you don't have to make it at 10:50, it's just a pilot. But the idea is that we are going to be here 10 minutes before in order for you to drop in and make some questions if you have some, or if you come, several of you come to the session a little bit earlier, you can also talk to each other in order to comment on the economic evaluation that you are looking at. So we'll just be here. If it's optional, we hope if you appear and hopefully it's good for you. But yeah, we'll see how it goes. Now, let's check the teams that we have this time. So we have team 10 about cancer care. We have team 11 about mental health, and we have team 12 about nutrition. So team 10 is led by Valerio, who's not here today, but is also led by Andy, who's here today. So I will ask you now to present yourself. So first starting with Andy, and then if we have people on the team here, the people in the team as well. So please, Andy.
Right, thank you. My name's Andy Clegg. I'm the theme lead for what's known as the MIDAS theme in the ARC, which is about the methodology, but I also work at the University of Central Lancashire as Professor of Health Services Research. Thanks.
Okay, so I think we don't have many people here.
I think I'm on the cancer team. Hi, I'm Jill. I teach on the BMed Science course over in Burnley. I'm the dissertation lead for there as well. So yeah, hi everybody.
Hello, nice to meet you, and yeah, hope you enjoyed the course. So do you have anyone else?
Yes, I am also in the cancer team group. My name is Temer. I'm a lecturer in pharmacy practice at UCLan. I'm a pharmacist and cancer pharmacist as a background, but at the moment I don't practice. I practice cancer pharmacy for 4 years, but since 2 years 3 years I'm here at UCLan. Yeah.
Thank you so much. Nice to meet you again. Nice I hope you enjoy the course. Anyone else from the cancer team? I don't think so. I think okay, so if not, let me go to the next one. So mental health, which is going to be led by myself. So again, I'm Luís Filipe. I'm an health economist. I'm a lecturer in economics at Lancaster University. and I'm glad to be here, and hope we have a nice time with this course. So do we have anyone from my team? Just looking here, I don't think there's anyone today. Is it true? Just looking at the participants? No, I think. Yeah, I think not. So let's go to the next one, which is team nutrition. So Misael.
Hello, my name is Misael Anaya. I work at Lancaster University. I'm a health economist also, and I'm doing research here in Lancaster University.
So I think we have at least one person from your team. Wait, sorry. And you are team nutrition, right? Okay, so we have here the presentation from Han. So I'm Han McCardle, NIHR public advisor and speech and language therapist with dysphagia, eating, drinking, and swallowing therapist. So dysphagia is specialism. Well, difficult words. You made me read. You wanted to make my life hard. No, just joking. Nice to meet you, and really glad you are here. And again, I hope you enjoyed the course as well. And I think today we don't have a lot of people, so I think that's it. So okay, so let's continue then. And before we really start the session per se, let's say about the content, let's just talk about author contribution, because like I told you, all that we are going to do, it's with the intention that at the end we can have a delivery. So we are going to learn about economic evaluations, but we want to apply that knowledge to something. And we decided that the best way to do it is to try to write a commentary on the economic evaluation of our choice, that we are going to do it together in each team. And yeah, I think it's a nice deliverable, right? That then we are going to try to publish. Now, since the idea is to publish, we are going to have authors, so we need to understand what is the author contribution. And by the International Committee of Medical Journal Editors, the recommendations are the following 4. So 1, it is required a substantial contribution to the conception or design of the work, or the acquisition, analysis, or interpretation of the data for the work. Now, I would say that this point 1, as long as you go to the workshop and you debate, you are doing a substantial contribution to the conception and the design, because you are literally debating, you are literally at the workshop doing the critical appraisal, coming up with, you will see later how the commentary is going to be structured, but you are coming up with suggestions for practice, future research, etc. So you are making a substantial contribution. So I would say as long as you make it to the workshop, this point 1 should be done. Then drafting the work or reviewing it critically for important intellectual content. So usually we tend to write most of the commentary. So we write the methodologies, then we tend to write the rest based on your suggestions during the workshop. Then usually we leave the introduction for you, but of course, after we have a draft, you need to go through it, you need to give your critical opinion, and that should be fine. Then final approval of the version to be published. Of course, you need to approve it. And then 4th, agreement to be accountable for all aspects of the work, which in short, it means that you take also responsibility, let's say, for what is within the paper. So that's it. I would say as long as you make it to the workshop and then engage with the revision of the manuscript, it's fine. You should be an author in the commentary. Now, that said, any doubts so far? There's been a lot of cleaning, but if you have any doubts, please tell me. Now today, starting with session 1, what are we going to do? So, like I told you, the aim is to identify a research question and select a suitable economic evaluation. And this is going to be done through several phases. First, I need to explain you what is an economic evaluation. Second, we will talk a little bit about how to define a research question and how to check if it fits the PICO framework. Then Cath is going to teach you a little bit more on how to do the literature search. And then finally, we will talk about the homework, which will be where you apply point 1 through 3 to then find a suitable economic evaluation for the RaCEEs. Now, starting with the first point, what is an economic evaluation? And first, in order to understand what is an economic evaluation, we need to understand what is economics. And economics, some people think it is accounting. It's not, even though we do learn accounting at economics. Some people think it's like managing a company. Well, that is management, but yeah, well, we learn a little bit of management in economics, but not quite. Some people think it is Bitcoins and choosing where to put your money in the financial market. Again, we learn a little bit of finance, but that is finance. Economists usually do some things that are a little bit broader in a sense. So what is economics then? I like to tell that economics is the science that studies choices. And why? Because economics, in economics, we basically realize that resources are limited and we have infinite needs that we want to be satisfied. So since we have infinite needs, we want everything and resources are limited, guess what? We cannot choose everything. So it means that we need to choose something. We need to choose how to apply the limited resources to satisfy some, not all, just some of the needs that we have. And we should choose it rationally in a way that with the resources that we have, we are maximizing something. Let's say we are maximizing our happiness. We are choosing the resources in the best way possible that, let's say, we satisfy the most important needs, and therefore we are maximizing our welfare, we are maximizing our happiness. So you can see that this thing about resources being limited and choices needing to be made create this problem of allocating our resources. We need to be really efficient. We need to be really rational and smart on how to allocate our resources. And in order to be rational, every time we make a decision to allocate resources somewhere, we need to understand why we didn't make a decision of allocating the resources elsewhere. So we need to understand what we are giving up, right? If I go to a supermarket and I decide to buy oranges and I don't buy, because I don't have enough money, let's say, and I don't buy apples, I need to understand that by buying oranges, I'm deciding not to buy apples. I'm giving up the apples, okay? So this comes down to the most important, by far, in my opinion, concept in economics, which is called the opportunity cost. So each time you choose something, you give up something else. And that's something else, the best second alternative, the one that you give up in order to make your choice, is called the opportunity cost. And whenever we want to study a decision, in order to understand why we made a choice, we need to understand what we were giving up. Okay, so economic evaluation will come down a lot to this. In an economic evaluation, usually this term is mostly applied in healthcare, even though it can be a more general term. But let's talk about health and healthcare. Usually, it's something like we have, let's say, 2 drugs or 2 treatments, and we want to choose between them. A lot of the times, one of them is probably the one that is already being used, which we call the standard of care, and the next one can be a new one, a new innovation that comes here to potentially replace that standard of care. And how do we choose between those two alternatives. Let's say the standard of care and the new innovation. How do we choose? So one thing that we look for sure, it's the consequences. So we have the one that we are using now, and it works in a certain way. Let's say it treats a certain amount of patients, or it treats patients with a certain probability. And now comes the new one. And let's say that the new one has better consequences. Let's say that it treats more patients, or it treats a patient with a higher probability, so a higher efficacy. So which one should we choose? Based on this information alone, we are tempted to say, okay, let's choose the new one, because the new one has a higher efficacy, it treats more patients, or it treats them better, right? And yeah, that seems like a smart choice. Now, however, by choosing to apply the new alternative, we are choosing to pay its costs, right? So it's not only about the consequences, the benefits, we need to look at the costs. And let's say that because it is a new innovation, it is also costlier than the other one. So should we only look at the consequences, at it being better, or should we look also at the costs? And the answer is that we should also look at the costs. And why? Because let's say it is more expensive, so it means that we are going to need to use our limited resources in order to buy this new alternative that has a better efficacy. Now, those costs, that money needs to come out of somewhere. So it means that because we are in a limited resource environment, it needs to be displaced from somewhere else. So yes, let's say that we implement alternative A, and marginally it treats more patients, but it's also costlier. So is the amount of extra patients that this alternative is treating enough to compensate displacing resources elsewhere in order to implement this alternative? Because maybe the resources that we are displacing elsewhere, they treat more patients. Let's say that this new alternative works for cancer, but we need to displace resources in respiratory diseases in order to treat more people in cancer. So is it worth it? Is the extra patients that we are treating in this new alternative worth the patients that we, let's say, stop treating in respiratory diseases? So that would be an example. And this is what economic evaluation tries to tell you, is if the new alternative is value for money. If let's say it is more expensive, then is it true that the benefits that the new alternative has compensate the displacement of other treatments that are out there? So that's the question that we are going to try to make. Now, let's do the following. Let's take a minute, stop for a minute, and I want you to try to think of a research question that can potentially be answered by an economic evaluation. I want you to write it down, and then after 1 minute, we will try to discuss your question, okay? So I'll count 1 minute from now, and at the end of it, we will talk. So, okay, 1 minute has gone through. So anyone brave enough to put the question? Feel free also if you want to write it in the chat, but if you have one question that you want to present.
I can start.
Hi, Tamer. Yes, please.
Hi.
Thank you.
So, I mean, it will be the use of new cancer drug versus standard of care, but I mean, of course, in the 1 minute, I didn't have time to check exactly which
No
one.
problem. No problem.
Yeah.
But
So
you have some in mind already, so you could have some of the technologies in mind, let's say.
Yes, yeah.
Yeah. So yeah, that's a typical one. I think that's a very good example. And in fact, cancer has been a little bit on the spotlight. Cancer drugs, a lot of the times people have basically. There was this. When I say this discussion about cancer drugs sometime being approved where they were not expanding much in terms of the life of a person. So they were very expensive and not expanding, sometimes expanding life by 2 months on average, 3 months, which is an interesting one, but it brings us precisely to the importance, let's say, of health economics, which is like, okay, let's say you have a new expensive cancer drug that expands the life of a person on average by, let's say, half a year, to not be too small. And the question is, yeah, of course, I would love to have the life of cancer patients expanded by half a year, for sure, and I would be willing to pay for it, for sure. Now, but the question is, since we have a constrained resources environment, if the drug is too expensive, is it worth putting the money there? Not in the sense that, of course, the life of those persons are very, very worth, but half a year, is it possible that by spending the money there and giving half a year on average more to those people, some other people in other diseases lose more than half a year, for example? So that is the question that unfortunately we are forced to try to give an answer to, because if we are taking more from another person, so if we are taking 1 year of life of another person in order to extend half a year of another person, that may be deemed unfair. But yeah, thank you. That makes total sense. Anyone else?
So I've got one.
Jill.
Hi. So obviously my sort of expertise is in microbiology, so I'm interested in the microbiome. So I would like to look at, say, how the microbiome may impact cancer outcomes.
Mm-hmm.
So maybe looking at the cost effectiveness of using that, sort of building up that microbiome rather than it just being a drug as efficacy with a drug.
I must admit I don't understand much. What is a microbiome?
So it's basically your gut biota, how your microbes in your gut and how they help you, and their impact on health. So there's a bit of evidence that having a good health diet and having a good microbiome can help good outcomes for cancer patients, for example.
Okay, that's interesting. And how are the treatments, let's say, or the interventions in order to improve the microbiomes?
So it's things like probiotics and different a very varied diet, for example.
Okay. No, yeah, that definitely makes sense. Checking the costs and benefits of those types of interventions. In this case, for cancer patients, and see if the cost is value for, if there's value for money, if the cost basically justifies the type of benefits that it should cause. That makes total sense. Thank you so much. Everyone else? So if not, we are going just here to give you an example. So this is an example we came up with. So just for you to see, to illustrate. So is physical exercise program cost effective in improving cognitive function for patients with stroke? And here we are going to use the PICO framework. If you are not familiar, PICO stands for population, intervention, comparison, and outcome. And we are going to put basically this sentence into a PICO framework. So we are going to see that in this sentence, the population would be adults with stroke. The intervention could be a physical exercise program, because that's precisely what we want to check. And then the comparison, let's assume it doesn't say, but let's assume that it's doing physical exercise, so it's against not doing the physical exercise program. So the intervention should the comparison should basically be no intervention or the usual care. And the outcome, we want to improve the cognitive function for patients with stroke, so it should be cognitive function. Now, I'm going to pass it to Cath, but just for you to see, if you want to search for it, it would be something like, in the population, we are interested in finding words like stroke, words like cerebral disease. In the intervention, we would probably be willing to find something like physical activity or exercise. Comparison in here, probably nothing, because it's the standard of care, it's the no exercise. But then in the outcomes, we would probably be wanting to find something like cognition. Those would be the words that maybe would help us in the literature search to find this type of question. Now, Cath, up to you. Let me just stop sharing. Okay. In the meanwhile, do you have any questions for me? If not, Cath is, I'll give it to Cath.
Okay, I'm just, can you see that okay?
Yes.
Perfect. Okay, so yeah, so we've talked about the PICO and how that can help us break down our research question into concepts. So as Luís said, we need to think about search terms that we'll use that will appear in relevant abstracts that describe the concepts that we're looking for. So we've sort of talked about that. Just a note on the comparison. So if we had a specific comparator, for example, if we were looking for papers that were comparing physical exercise to antidepressants, for example, we would want to have terms for antidepressants because we're looking for a specific comparator. But where you, as we've said, don't have a comparator, it could be any comparator or usual care, I would recommend that we don't have search terms for that, because there would just be too many variations, too many variables. So once we've thought about what search terms we want to use, we'll want to put these into a search and to formulate a search strategy. I'll just say here that there are there's more than one way of conducting a search in most databases, but today we're just going to keep things very simple. So we're going to put together a single search string, which comprises of all our search terms. So just a couple of notes on the commands that we want to use when we're searching on a database. The main commands are or and, sometimes called Boolean operators if you're feeling fancy. So or tells the database to search for either or any of the search terms that we type in. So searching for stroke or cerebrovascular disease will return abstracts that either have the term stroke or the term cerebrovascular disease somewhere in the abstract. And tells the database to search for all of the search terms that we type in. So searching for stroke and physical activity will return abstracts that have both of those terms within the abstract. So or is more and makes the search more focused. So we will use or to combine the terms for each of our concepts, and then and to combine the concepts together, and it will make more sense in a second when we have a look at a search string. Another tip is where we have search terms that are more than one word, and we want to search for these as an exact phrase. If we put them in quotation marks, that will tell the database to retrieve the term as an exact phrase. So for example, stroke is a single word. We don't need to put quotation marks around a single word, but cerebrovascular disease, we'd want to put that in quotation marks to tell it, the database, to search for that as a specific phrase. If you don't use quotation marks, most database platforms will default to searching for both of the terms, but not necessarily together. So you will still find relevant results, but you may find many more irrelevant results because the terms could appear anywhere within the abstract. So it's a bit like when we have a single search string, it's a bit like a maths equation. We need to group our search terms together using brackets. So for each of our concepts, we'll group the terms with brackets, and then in between each set of brackets, we'll have the command and. So we will do our population terms, stroke or cerebrovascular disease, and physical activity or exercise in brackets, and cognitive or cognition, which are our terms for our outcomes. Then we also, because we want to find economic evaluations, we're going to include some search terms that will help us to identify papers that are economic evaluations rather than other types of research papers. So we have and cost or price or expenditure or expense, and economic evaluation or cost effectiveness. So this will help us to identify the right study type. And these slides will be available to you after the session, so you'll be able to have a look at this search string and formulate your own in a similar way. So we're going to show you how to run this search on PubMed. This PubMed is a database which is produced by the National Library of Medicine in the US, and it is free to search. It's available globally. You don't have to pay to use it. So we're demonstrating this database because everyone will have access to this. You may have access to other databases in your organisation, so the same principles will apply. If you want to use another database, that's absolutely fine, but we're just demonstrating PubMed today because everyone can access it. And PubMed comprises of the Medline database, so that's a massive general medical database. It covers all types of healthcare literature, so it's a really good one to use in any case. So I'm just going to stop sharing that. And can you still see my screen? Can you see PubMed? Yep. So this is PubMed. There is an advanced search function, but today we're just going to keep things simple and we're going to use the basic search. So you can see there's a big Google type search bar in the middle of the screen. So we're going to just type it in our search strategy. So it was stroke or cerebrovascular disease. So put that in brackets, then and then our terms for the intervention, which is physical activity or exercise, and our terms for the outcomes, which is cognitive or cognition, make sure I spell it correctly. And then we've got our terms for our economic evaluations. So we have cost or price or expenditure or expense, and economic evaluation, or cost effectiveness. And then we click on search and it will run search. Okay. So we have results. Sessions appear in the middle of the page. Let's check something, 1 second. Typed in something incorrectly. Yeah, I just missed a quotation mark at the end there. Okay. Sorry, that's better. So results appear in the middle of the page. Down the left-hand side, there are some filters. So the most useful of these will probably be publication date. Ideally, we want something quite recent, something that's published within the last 5 years. Although if you can't find something within the last 5 years, we can go slightly older. I'm going to filter my results to 10 years just because I want to demonstrate a few of the different results that might appear in your results set. From the 17 results we have, we now have 8 results. So if you click on the link, we can have a look at each of our results. So I'm just going to go through some of the results that you might find when you do your search. Although we have searched for economic evaluations, these words could appear in abstracts that are not economic evaluations. They could be appear in discussions, and it can be a little bit tricky to spot the right study type. So I'm just going to go through a few of the results just so we can talk about some of the things you might see and what papers are and aren't good for our RaCEEs project. So this first result, we can see we've got the full abstract here. If you have a look, the title clearly says it's an economic evaluation of exercise or cognitive and social enrichment activities after stroke. So this looks like it's the perfect paper, really. And if we look at the objective, it is to conduct a cost effectiveness and cost utility analysis. So it meets our population and it's the right intervention, and it is an economic evaluation. It's looking to do a cost effectiveness and cost utility analysis. So this is an economic evaluation. This would be the ideal paper. If we look at the next result, it's mentioning cost effectiveness in the title, but at the end of the title, it states that it's a study protocol for a randomised controlled trial. So a study protocol is a plan of what the researchers are going to do in their study. So it's a plan of what they're going to do in the randomised controlled trial. So this is not suitable for our purposes. It's not the right type of study. It's a trial protocol. Again, the next one looks a little bit less relevant anyway. It's about strategies to support home-based exercise after stroke, but the study type is a Delphi consensus. So a Delphi consensus is when experts come together to sort of look at the evidence and have a discussion and come up with sort of guidelines and recommendations. So again, this is not an economic evaluation. It probably mentions cost effectiveness within the abstract, but it's not a suitable study type. The fourth abstract, this is discussing using quality adjusted life years. So it is about health economics, but if we look at them, sort of read the objectives, it's actually a methodology paper. So it's looking at how quality adjusted life years, which we'll come on to look at later in the course, how they're used to sort of measure healthcare resource allocation. It is not in itself actually conducting an economic evaluation. It is sort of a methodology paper. The next paper isn't the right population, and it is looking at cardiac rehabilitation for heart failure. So again, this probably wouldn't be relevant to us, but just so we can have a look at the sort of the study types, this is a cost effectiveness analysis. They are looking at a decision model based analysis. They're mentioning sort of the models that they've used, and then reporting on sort of the economic outcomes. You might notice here they haven't actually used the word economic evaluation, but this is an economic evaluation. So if it was the right intervention and population, this would be suitable. And just finally, one more. This looks very promising. It's economic evaluations of physiotherapy for neurological disorders, but it is a systematic review. So a systematic review is a type of research where They pull together all of the research that has been in on a topic, and they create a synthesis, sometimes with a meta-analysis. So this is a systematic review of economic evaluations. So this is not suitable for RaCEEs, and you might see these coming up. It's a systematic review of an economic evaluation. It's not a primary economic evaluation. So I just wanted to highlight, because sometimes it is quite difficult to spot the right study type and the suitable paper. If we go back to our search results, I think the first one was our sort of the best bet, the best fit for us. In the right-hand corner of the screen, you can see there are links out to the full text. And in this case, this paper is available open access. That means it's free to access. So we can just click on one of these links and we will get the full text paper. If the full text is not available, just let us know and we'll help you to see if we can help you to access a full text version of the paper. Okay. Let's go back to my slides. So that is sort of how to do a search. Oops. Sorry. So if you find that your search returns thousands of papers, you might want to try adding additional terms to narrow your search down. So for example, if you might want to use more specific terms, you might want to add another concept into your search. Conversely, if you don't find any relevant economic evaluations after your first try, you might find it helpful to remove one of the concepts from the search. So for example, if you've searched for population terms, intervention terms, and outcome terms, you might want to remove the outcomes. Sometimes these aren't very explicitly described in abstracts, so you might just want to search for the population and the intervention. You might want to try adding some more terms to your search. So for example, for our physical activity terms, you might want to add some terms for types of exercise like yoga, swimming, walking, and that might help us to find more papers that might be relevant. So just to work through an example, first we tried a simple search string just looking for stroke and physical activity, but that search produced 5,074 results, which is definitely too many. Then we added the outcome to the search string, so we searched for stroke and physical activity and cognitive. That helped to drastically reduce the number of results, so we found 536 results. However, just searching for those three concepts, we'll find lots of clinical research as well as economic research. And as we're specifically interested in finding an economic evaluation, we wanted to redefine our search string a bit more. So then we tried the full search string with the economic terms as well, and we got 17 results. Okay, so we'll just stop sharing there. Does anyone have any questions about the search? Okay, I'll hand back to Luís then. Luís, you're still on mute.
Thank you so much. Sorry. Thank you so much, Cath, for your help with the literature search. So now you should look back at how to do the literature search and try to find your economic evaluation. So this is the next step. So now what you will have to do is you will have to do the search. You will have to look at the abstracts of the papers and try to identify a suitable economic evaluation. If the abstract is not enough, try to look at it as well as the full text. Again, like Cath said, if you cannot, if it is not open access and it's not available to you, feel free to come to us and we can check if we have access to the paper and send you for you to check. Now, here is just a table with some criteria to help you do the selection of the economic evaluation. So it's not mandatory, it's just for you to come back to the slides when you are doing it, and if you want, use this checklist. Now, let me just tell you something. We are aware that, for instance, we have not explained you several things that would help find a suitable economic evaluation. For example, Cath was looking at the terms like cost effectiveness or cost utility, or it was not there, but cost benefit could also be a term. Then you had Markov models, incremental cost effectiveness, things like this. We know that you don't know this yet, you will, but since we are asking you right now to go and do that, just don't be shy, don't be afraid to make a mistake. Just go for things that you find interesting, and then we will give you feedback. Feel free to contact us and make us questions. Just don't worry, it is normal. So this leads us to our first homework, which as a task 1 is what I already said. Each one of you should search and select a suitable economic evaluation by doing the search on PubMed or other, like Cath explained. PubMed is good because it is open to everyone. Then you should write down the title of the abstract on Teams and paste the link to the economic evaluation so that me and your colleagues or your team leaders can see it, and do it below your name. You are going to see that there's already a document there for that. And we ask you to do this task by task 1 and 2 by Tuesday, the 27th of May. We will send you some reminders, so don't worry. Now you can see that if you go to your space in Teams, which you should already be been added. If you have any trouble accessing Teams, please tell us, and we are going to do everything in our power to help you. Just go to your files. You will see that there's one folder already for session 1. You enter it. There is already one document for the first homework, which is the selection. And then if you open it, there will be already in the document your names for you to put the title of the economic evaluation that you found, and for you to put a link so that that others could access your economic evaluation. Now, the task 3 is going to be to then have also a look, once everyone has put all their economic evaluations in there. We will ask you to give a quick look at the economic evaluation selected by your teammates and give an indication of which economic evaluation you prefer. You can do that by using the Teams chat and kind of give a vote on it. Please do this by Friday the 30th. And what I can tell you is that usually we try that your votes are the ones being chosen, but again, we are totally aware that we didn't give you yet enough information for you to make a fully proper selection of the economic evaluation, so your team leads will have the last word. So if for some reason they believe that the one that was most voted lacks some traits, some features that we would like to have for you to learn better and make, let's say, to enjoy this course to the fullest, it may not be the one selected, but don't be shy. Please select your economic evaluations. Please vote. It's totally normal that you don't know everything yet, but hopefully by the end of this course you will be fully prepared. So that's it. Do you have any questions? If you have, please make them. Thank you so much. Thank you to you. Thank you to Cath. Thank you so much for coming here today.